we get into the habit of standing on one leg and leaning all our weight off to one side, we can really create muscle imbalances in the body. And equally, when we get into the habit of standing with our pelvis in an anterior tilt or a posterior tilt, that was just really exaggerated. It might not be that obvious. It might be just a subtle shift of the pelvis. But when we get into the habit of standing in a certain way that isn't really supported by our postural muscles, then we can end up seeing imbalances or weak or just switched off gluteal muscles. One thing that we can do to train these is to work on medial and lateral, so internal and external rotation of the femur bone in the acetabulum of the hip. So what this is useful for is switching on some of the muscles that support us in standing and walking. If we were to accidentally trip and fall over, these are the muscles that maintain our posture. So find yourself a yoga block. One of these foam ones is nice because it's not very heavy and it doesn't hurt to grip it between the legs. And if you don't have a yoga block, you can just get a towel and just roll it up. So that does the exact same thing. You just need something that you can put in between your legs and grip using the muscles of your thighs. So with this yoga block, I want to aim for the center of it to go into the center of my inner thighs. Then I'm going to stand with my feet about hips distance apart. So my feet are pointing forwards, my knees are trying to point forwards, and the feet and the knees are in line with my hip bones. Then I'm going to organize my core, so I'm going to shift my weight forward, shift my weight back, and try and find the center of those 2 points. So I know I'm standing in neutral. I want to be able to wiggle my toes, so I know there's enough weight back in my heels and I'm not leaning forward. And then head over heart, heart over pelvis, everything in line. Okay, from this point your knees can soften a little, but you're aiming for straight legs. You're going to send your object forwards. Now what's happening here is the thighs, the femur bones, are externally rotating, and you should feel your glute maximus muscles squeeze, so your butt cheeks will turn on. And then we're going to send the object back behind us as if we're trying to pass it to someone behind us. What will happen is the femur bones will internally or medially rotate, and you'll feel a relaxing of the glutes, and even as if your butt cheeks are spreading a little. What this looks like from the side, again, find your neutral posture. We're going to send the block forward, external rotation, glutes engage, and then send the block back, medial rotation, glutes relax. We're just going to work through those two. And this is training us to feel when we are sending the weight of the pelvis forward. So notice if you're kind of leaning forward and going into your toes. Notice if you're leaning back. If we want to try and stay centered, again, a little softness to the knees is appropriate, but we're trying to keep the legs straight. And we also want to be mindful of the torso, no leaning forward, no leaning back. The only thing that should be working is the muscles which externally rotate the thighs and internally rotate. So this is hip rotations. From a standing position, the movement's going to happen in the thighs, in the femur bone. And it could be a teeny tiny movement at first. It might even feel like not a lot is happening. But we're trying to teach the body to find neutral. So if I take this into the extreme external rotation, the block, I'm squeezing it forward towards you, and my glutes are on, my butt cheeks are scrunched. And then if I send it the other way, medial rotation, there's even what starts to happen is a little bit of a duck butt, a little bit of anterior rotation happening. So you're trying to find the neutral between these 2 points. So you want to go to the extremes so you can teach your body where middle is, where neutral is. So not only do you strengthen those rotators with this little exercise, but it then gives your body a sense of proprioception as to, okay, well, where am I putting my weight? So if you often stand on one leg with your hip hiked out to the side and probably this knee locked, this is a habit forming stance that will then start to affect tightness in your QL and your lower back, and essentially you're making yourself more wonky. So when you're standing, especially if you're waiting in a queue, try to think, where am I putting my weight? Forward or back? Can I find center? Do I have my thighs rotated inward or outward? Can I find center? Am I leaning forward or leaning back? Can I find center? Are my knees relatively soft, or am I locking my knees? So that's another one. I find a lot of times people will lock their knees. So we're looking to find the equilibrium, the neutrality in each of these. And if you can do that, not only will it make your waiting time lessen if you're stuck in a queue, but also it's going to help you train your body to have that proprioceptive awareness of where you are in space and where your weight is distributed. It's going to help you to get rid of the habit of standing on one leg and dumping all of your weight into those joints. Enjoy!